Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The Integrated and Sustained Childhood Pneumonia and Infectious Disease Reduction in Nigeria group insists that observing COVID-19 safety protocols is vital to stemming infectious diseases spread. Network of civil society organizations in Yobe State laments setback of the pandemic on humanitarian activities in and around the state. And China's Winter Olympic hosting threatened as almost 250 locally transmitted COVID-19 cases occur in 10 days. And with unvaccinated people particularly exposed to the virulent Delta strain, while the global deaths related to COVID-19 nears the 5 million mark, and that's according to Johns Hopkins Coronavirus Resource Center. The Nigeria Center for Disease Control, NCDC, said the country recorded no new death from the pandemic, which has since claimed 2,884 lives nationwide. The NCDC, in its update last night, reported 159 new cases recorded in 13 states of the Federation and the FCT, with the Federal Capital Territory and Lagos State reporting 28 cases each, followed by Nasarawa with a backlog of 25 cases for October 24th, 2021. Total active cases stand at 5,643. Let's take a look at the virus update.
159 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT, indicating a drop from the figures reported earlier. The highest number of new infections reported from Lagos and the FCT with 28 cases each. Nasarawa and Plateau have 25 and 24 cases, while Kwara has 22. Delta and Kanu registered 8 cases each. Rivers reported 7. Edo, Bauchi, and Bayelsa had 2 each, while Kaduna, Sokoto, and Taraba had 1 each. Today's report includes backlogs from Delta and Nasarawa. The total caseload in Nigeria has risen to 211,330. 129 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 202,803. There were no additional deaths from complications reported in the last 24 hours, keeping the fatality toll at 2,884. Currently, there are more than 5,600 active cases in Nigeria, while over 3 million samples have been tested so far. The latest update from the National Primary Healthcare Development Agency shows that more than 5.5 million Nigerians have received the first shot of the vaccine, while over 2.9 million persons have been fully vaccinated. The agency says the Moderna, AstraZeneca, Pfizer, and Johnson & Johnson brands of the vaccines are available in the country and is advising Nigerians to ensure a complete dose for full protection against the virus. Globally, more than 6.8 billion vaccines have been administered. In Africa, there are more than 8.4 million confirmed cases and over 217,000 deaths have been reported across countries on the continent.
The network of civil society organizations in Yobe State say the outbreak of the COVID-19 pandemic has slowed down operations of donor partners, rendering humanitarian activities in Nigeria's northeast that is affected with Boko Haram insurgency. The executive director of the network, Baba Shehu, disclosed this at its annual general meeting in the matter of the state capital to receive feedback and also strategize for challenges ahead.
The United Nations Development Programme and the National Bureau of Statistics September 2021 report reveals that about 20% of the full-time workforce in Nigeria lost employment during the COVID-19 pandemic in 2020. The network of civil society organizations in Yobe State says they are at the receiving end, as most of the donor partners have limited their funding as a result of restriction of movement and lockdowns across the country.
A lot of our partners are not operating in full scale. Therefore, the opportunities for partnership between the civil society, the government, and maybe the non-governmental agencies has shrinked during the period of COVID.
Some of the humanitarian organizations explained their experience during the 20 months of the pandemic in Yobe State.
We work in the protection sector where we provide survivors of gender-based violence with comprehensive services. But because of the pandemic, there were a lot of restrictions, which more especially in terms of getting access to communities has become a challenge for us.
We need to be on the rural, in the rural communities to see for ourselves, because in some cases, you know, the political atmosphere in the northeastern part of Nigeria is that sometimes people not willing to open up. Even if something is not right, they will not able to open up for you. But if you go on your own, you have to find out what is currently happening in the rural communities.
Yobe is one of the states with the least number of confirmed COVID-19 cases in Nigeria, with just over 500 cases and 9 deaths. Yobe is 34th on the table, yet has been greatly affected economically.
And making sure that infections do not spread from patient to patient or doctor to patients is very important in the control of the COVID-19 pandemic. The chief of Party Inspiring Project, Dr. Adamu Issa, reminded attendees at the flag-off of the distribution of personal protective equipment and oxygen cylinders to 33 healthcare centers in Jigawa State.
According to the Nigeria Center for Disease Control, NCDC, 16 persons are on admission in Jigawa, and the state has recorded 598 cases since the outbreak of the pandemic, with 17 fatalities. Chief of Party Inspiring Project says controlling the spread by using protective equipment like face masks and surgical gloves are key in the fight against the pandemic.
Well, it is true COVID is going down, it's no longer that much, but in a hospital, the issue of infection prevention and control is continuous. You would not want to go to a hospital with malaria and come back with HIV/AIDS. Nobody would want that. So you have to find a way of prevention of transmission of infection between patient to patient, between patient to the health worker, or between the hospital and the community. So that is what we are trying to do by providing the infection prevention commodities.
According to the Permanent Secretary, Ministry of Health, efforts like this will help the state to achieve its target of universal health care coverage.
As I'm talking, last 2 weeks, we have 279 PSCs across the state. That's what we call primary health care at the political world level. We have 279. All these PSCs, they have been captured. And vulnerable groups have been registered in these wards, about 150 for a start. In every ward, including disabled men, young children, other vulnerable groups. And their capitation has commenced 2 weeks ago. So by meaning that all these 279 wards, now they have facility and they have access to care of at least 150 patients on a monthly basis. And this thing has commenced to eternity.
Since the outbreak of the pandemic in Jigawa, authorities have been battling to improve the quality of healthcare delivery, especially in rural communities. It is pertinent that members of the community also do their part by adhering to protective measures.
It is widely expected that children ages 5 to 11 will soon become the latest group to be eligible for COVID-19 vaccination in places like the US, while in South Africa, vaccination has started for children ages 12 to 17. But as a few other countries start vaccinating their children, some as low as 3 years, as the pandemic also continues, will that time come in Nigeria? When indeed? And the question really is when, considering the number or the supply of vaccines that we're getting. Well, joining us to talk more about this is Dr. Atinuke Uwaje. She's a consultant pediatrician, Pediatric Partners Hospital. She joins us virtually. Thank you for joining us on the program. I'd like to begin with asking first if perhaps we are witnessing, if you've experienced any, a higher number of children coming down with COVID-19 in Nigeria, like we're really seeing in other parts of the world.
Yes, we've actually the trend more kids testing positive for the COVID-19 virus infection, but just similar to the other parts of the country, to other parts of the world, we haven't had really severe cases where we needed to have so many cases been admitted. Or on the whole, most of the kids are pretty okay, even when they have the infection. So we have a few that ended up with the multisystemic inflammatory complication of the COVID vaccine, COVID infection. So almost similar to what the other countries in the world are experiencing.
But perhaps not as much, like you've mentioned. But if we look at the problem of vaccine supplies in Nigeria and looking at how other countries are racing to vaccinate as much as their population, including the children, at what point do you see us getting our children vaccinated? This is in view of supplies on the one hand. Perhaps on the other hand will also be our virus curve.
Well, even if you look at our rate of vaccination for our adults, when we compare them to other countries, we're not where we really should be. But I know that a number of healthcare professionals were waiting to get the vaccines and encouraging parents to have their kids vaccinated. So once it's available, a number of us pediatricians and primary care physicians are really ready to get those vaccines in our children's arms.
Also, still with, vaccinating children, adults, some of them are definitely not happy with it, especially the fact that they're saying the vaccine mandates that we're seeing. Do you think that there might come that time where perhaps parents might also be hesitant? And there are some that exist for countries that are vaccinating children.
Well, if you look at vaccines in general, even for those ones that we know, they've been proven and tested, we still have some parents that have hesitancy in giving their kids those vaccines. One in case is the measles, mumps, and rubella. And the thoughts that this may actually be related or may have some kind of causative effect on autism. So I'm sure that we're going to get a number of mothers, a number of parents who would be a little hesitant in us giving vaccines to their children. But I think on the long haul, that we as providers, we must believe in it. And then the ability, when we believe in the effects and the efficacy of vaccines, then we're able to also convince parents that, look, this is good for your child. I know a lot of families who have had one form of death or the other. I have had a personal experience. We're quick to want to vaccinate because, when we think that, if our family member had received this vaccine, perhaps they would still be with us today. And so we're having that conversation with our parents. And I know a few parents have actually asked regarding the possibility of getting those vaccines to their kids. But I don't know, it depends on really what the government says regarding mandates. I know that even in a lot of these first world or developed countries, there are people who are actually taking those governments to court to question the mandate of those vaccines. So I'm hoping that we'll get a lot of people who would agree with vaccination, and hopefully we'll be able to at least get our so-called herd immunity, so that even if we have COVID-19 infection with us for a while, at least, we have a lot of our kids protected, or even the general population protected.
That's very true. And finally, Dr. Waje, perhaps in 30 seconds, what's your advice to parents, to children, to adults, given the circumstance in Nigeria?
Well, I think, first of all, we need to continue to practice social distancing. We need to still, when we're in public places, to use our face masks. We need to practice healthy and good hand washing. I think those preventive measures are very, very important, not only in protecting us against COVID-19 virus, but actually in protecting us against so many infections. And really, that's what we pediatricians have said all along. Good hand washing, it does saves us from a lot of infections. So, and when the vaccine is available for our children, I'm going to encourage parents to please go ahead and get those vaccines for them. Thank you.
We appreciate your time. Thank you so much, Dr. Atinuke Waje, consultant pediatrician. Thank you for joining us on the program.
Thank you.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. The adverse effects of COVID-19 on the economy of states are quite evident to some budget experts on the sidelines of a special session for state budget assessments in Ekiti State describe COVID-19 as an economic intrusion that caught states unawares. Well, for the Senior Program Officer Budget Foundation, while the pandemic took its toll on federal and state budgets, they also spotted insincerity in the way some states manage the distribution of palliatives procured with state and donor funds.
When COVID came, businesses, economic activities were down, and government could not raise the funds that they needed. Even the few funds they raised, they managed to raise. So many subnationals were putting in place isolation centers, buying COVID-19, trying to buy lab equipment to ensure that the tests are being carried out in their respective states. So there was a movement from other economic activities to the health of the citizens. So I think it really affected the budget of most of the states because the economic activity were grounded. Not even at the subnational level, even at the federal level, even in the world entirely.
So our next discussion we continue, and this time with the global outlook of COVID-19 in children, which has been on the rise in some countries with a recent 10% increase in the total number of reported child cases. While all children are capable of getting the virus that causes COVID-19, they don't become sick as often as, children have mild symptoms or they have no symptoms. They don't become as sick as often as adults. Well, joining us to talk more about this global view, Dr. Shola Faniro is a developmental pediatrician at Mediclinic City Hospital and clinical associate professor of pediatrics at Mohammed bin Rashid University. She joins us from Dubai. Thank you for joining us on the program.
Thank you for having me.
Now, let's start with the COVID-19 vaccine for children, and this is in the UAE. What is the age range, and have a reasonable number of adults been vaccinated?
Well, starting with the children, we do have approved vaccines for children, and there are two main ones in the UAE. So the Pfizer vaccine is approved from 12 years and above, while the Sinopharm is approved from 3 years and above. And there has been good uptake of that as well. And roughly about a third of children have now been vaccinated with the COVID vaccine. But when we talk about adults, it's really amazing. And it's a good time to be living in the UAE because UAE has the highest uptake of vaccine in the world, with about close to 90% of adult residents having one vaccine and close to 80% already fully vaccinated with at least 2 vaccines.
Staggering figures there. But if we look at the safety of the vaccines, especially the ones approved for children, there seem to be quite a number. And our parents, what do they think about this? Are they open to their children receiving the vaccines?
Well, I guess when we talk about safety concerns for vaccines, it's the same concern that people have had about the adult vaccine, thinking maybe this was rushed, it wasn't well researched. But on the contrary, all these vaccines have gone through rigorous testing. They've been tested a lot, and they've looked at all the potential difficulties that might happen in children. So yeah, it's well tested. Now, any vaccine or foreign body that you put into someone has the potential of risk, but the COVID vaccine up to date doesn't have any more significant difficulty than any of the vaccines that we've had. And I guess, again, because of the way it's been explained to the community, quite a number of parents do ask. And I'd say a significant number of my pre-adolescents from age 12 and above have had the Pfizer vaccine. In particular, any one of them that has any chronic medical problem like asthma or any inflammatory disease. Because unfortunately, as you mentioned earlier on, we are seeing more cases of children having quite significant infection or being sick with COVID, in particular with the Delta strain. So when we had an upsurge of the Delta strain, then we had a corresponding increase in the number of children that have quite serious infection with COVID.
Before those children that have had COVID, have there been cases of long COVID-19?
Long COVID is not as common in children. On the contrary, children tend to get something we call MISC, MIS-C, which stands for multi-system inflammatory syndrome in children. And basically what that means is every single organ in the body is attacked. So quite a number of these children end up in intensive care. But with good treatment, luckily a lot of them have survived and there has been minimal fatality in children. Long COVID is more in adults, and it is a big problem. And for some of them, it can be quite debilitating. So one of my friends, a nurse who works in the COVID ward in UK, ended up with low heart rate. So her heart rate was dropping down to 30, 40 until she was fainting at work. Some people, they just have prolonged fatigue. So we do have a problem with long COVID, but luckily it's not as bad in children.
Finally, this statement, I think it applies to children and also adults. You know, for example, that children are just as vulnerable as anyone else who has not been vaccinated, but unless they have underlying health conditions, they are less likely to get sick and die from COVID. However, less likely does not mean impossible.
That's exactly right. And that's why not only should we start seriously advocating for children to get vaccinated once the childhood approved vaccines are available in your area, but also to keep taking on all the precautionary measures that has been instigated in your areas. Wearing your mask, washing your hands, maintaining social distancing until we know that a large proportion of the community has been vaccinated.
We'd like to thank you, Dr. Shola Faniro, is a developmental pediatrician at Medi Clinic, City Hospital, and Clinical Associate Professor of Pediatrics at Mohammed bin Rashid University in Dubai. Thanks for joining us on the program.
And thanks for having me.
A leader of Britain's opposition Labour Party, Keir Starmer, has tested positive for COVID-19. House of Commons Speaker Lindsay Hoyle says Starmer will be replaced by his party's business spokesman Ed Miliband at the weekly session of questions to Prime Minister Boris Johnson because he was isolating. Here's more on the global update.
Global Updates continues in China, which has reported nearly 250 locally transmitted cases of COVID-19 since the start of the current break 10 days ago, with many infections in remote towns along porous international borders in the country's northwest. China had 50 new local cases on Tuesday, the highest daily count since September 16th, according to official data. China says the COVID-19 pandemic is the biggest challenge to its hosting of the Winter Olympics in February. Meanwhile, Bangkok's main international airport staff, pretending to be foreign tourists, participated in a drill today to test the immigration system before Thailand reopens to international visitors next month. Tourists are required to present a Thailand pass to the health officer and immigration upon arrival. The document comes in QR code form, which aims to replace the certificate of entry or COE given by the Thai embassy or consulate. Facing the toughest restrictions since the early months of the pandemic, many Russians have decided that now is the ideal time to fly off for a foreign beach holiday instead of hunkering down at home. Workplaces across Russia are due to close in the first week of November for paid non-working days to slow the relentless spread of COVID-19. Today, Russia reported 1,123 new COVID-19 deaths, its highest one-day toll of the pandemic so far. Finally, 8,000 Nicaraguans have received COVID-19 vaccines at 2 customs border crossings with neighboring Honduras in recent days, as supplies of the inoculations in the country have run low. President Juan Hernandez said on social media that the solidarity and brotherhood of Hondurans crosses borders, adding that up to 500 doses were being given out daily to Nicaraguans.
Fresh air can help reduce the spread of COVID-19. If you're meeting friends, head outside to help drive the virus away. Continue to take responsibility. You can visit our websites for more updates, breaking stories, and also a better understanding of the pandemic. Our top story there is our sharp drop from yesterday's, previous day's cases. It's channelcv.com. News at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.